I welcome everybody. I am excited to welcome you to our October Guess Who panel. This is our Your Career Search Shouldn't Be Scary version of our Guess Who. And so I'm just getting our PowerPoint loaded up so that everybody can see that. I am really excited. This is the largest Guess Who panel we've ever hosted. We have 7 amazing students here. They are going to do their very best today to try and stump you. They're going to give you clues about what they do as a health professional student without really telling you who they are. I'm Mandy now. I'm the Executive Director of Health Professions Week. I'm going to be leading you through this particular session today. And so I want to get started by just telling you very briefly about who Health Professions Week is. We are made up of health professional and education organizations that are listed here on this screen. I like to say that from the eyes to the toes, we represent a lot of different health professions that are career opportunities for students. And so the students today are going to come from one of these health professions. And there are definitely health professions here who represent more than one career path. I'll call out the dental professions. We represent both students who aspire to be dentists and students who aspire to be dental hygienists. And what Health Professions Week does is offer tips, tools, ways to engage with these different careers to learn more about them. We have a really fun tool, and I hope that if you are sitting at your laptop or if you've got your cell phone nearby, that you will jump into our Slido. And I'm gonna jump into the Slido as well so that I can follow along in the conversation. All you need to do is point to that QR code, and this QR code will be on every single Slido. So let's just see how people are doing now that we've all had a chance to get into the session. And so I'm going to have you do a quick candy corn is. Give me your opinion on candy corn. Tasty, wonderful, yummy. Excellent. All right, we got a lot of okay. I'm just going to be honest. I fall into the candy cone is gross category, so I'm liking the people who are like it's waxy. And I can see that we've got a couple more people typing. So, okay, we obviously have a pro candy corn crowd. So, okay, so now you can see a little bit more about how this tool works. When we don't have an open poll, it will slide over to the Q&A section. And so as we're talking today, if you have questions, go ahead and feel free to put those into the Q&A, and we'll get to some of those questions as we get through the first part of this panel. All right, 1% gross. So we are definitely a 50-50 split today. Excellent. Oh, okay. All right, here we go. Let's just do one more test. Make sure that everybody is doing okay. And in our, yep, where are you from? Oh, we got an international crowd. We've got somebody from Canada here today. That's awesome. Welcome. Well, thank you from whatever time zone you are joining us from. Thank you for being here today. All of you in attendance, tomorrow you will get a copy of this recording, so don't take notes, just play along, just enjoy the session with us. You'll get a copy of it that you can watch. And for anybody who was hoping to make it to the live session, those also will go out tomorrow. So everybody who is registered gets a copy of this, and it'll be on YouTube tomorrow afternoon as well. All right, thanks for telling us a little bit about who you are so that we can share who we are. Pretty basic rules. You're gonna listen to the speaker. You're going to listen for clues. You're going to match the speaker to their career. You're going to put your guess in the poll, and then you're going to see if you are right. And then you're going to register for one of our upcoming webinars, but I'll get to that in just a couple of minutes. Okay, so next poll. That was a really long list of professions. It's like over 20 different careers. Would you like a clue? Oh, okay. So all of you who voted no or I got this, right now, I want you to look away from your screen. I want you to close your eyes because you don't get this hint. These are the health professions from that very long list of health professions that I shared with you earlier who are here today. Okay, you can come back to the session. And I think what I'm going to do is I'm going to turn my screen off just so that we can see everybody's faces a little bit better. So, hi, welcome to all of our speakers today. It's so nice to have you here. Tatiana, you are first in my Brady Bunch. You get 1 minute to describe who you are and give us some clues.
Okay, great. Lovely to meet you all, everyone out there on the web. So my profession is very broad. We work in a lot of different healthcare settings, including hospitals, walk-in clinics, sports teams, schools, all over the board. And we deal with all ages as well, from infants, children, adults, older adults. Our primary role is to assist and direct a patient's recovery after any sort of condition, surgery, injury, and we work and deal with a lot of the different systems of the body. We also are called an expert in musculoskeletal systems, and our profession requires us to be a doctor in this field, but not the same as you would think of your typical medical physician.
That was a great clue. I love it. Thank you. All right, Bryn, you are up next.
All righty. Okay, so I can care for you when you are healthy and also when you're sick. I observe you from the outside, but I can also get a peek inside. So I get to see the blood moving through your vessels, and there is no hiding from me if you have uncontrolled diabetes. I can work in a hospital, I can own my own practice, and I can even work for professional sports teams. There is a huge variety of places I can take my career. I may see you for the first time as a baby, and I can see you through all phases of your life. You may not see me at the start, but by the end, I should be nice and clear.
Wow, that was really good. Awesome. I love it. Okay, Stephen, you are next in my particular Brady Bunch. So what's your clue?
All right. I don't want to make this too easy. So let's see. You can find me in the operating room. A lot of times I'll be there, working there. What else? I work as part of a team, and so there'll be multiple other providers or healthcare professionals that I work with and interact with. I do have a bit of direct patient care, and so I'll be working directly with patients a lot of the time. And let's see what else. It's a great blend of both patient practice as well as intellectual stimulation. I'll leave it at that for now.
Great clue. That was fantastic. All right, Samuel, you are our next provider of clues.
Hi, everyone. So my profession is the easiest or the most easily accessed part of the healthcare team in your community. What I deal with, it's mostly I spend my time in the lab, just combining regular or common stuff just to make them extraordinary for your healthcare. What I deal with, you don't always need a doctor's approval for it. You can get it by yourself if you think you should need it. Uh, And sometimes at the end of the day, you ask yourself if this is the right thing that I took, because regardless, I'm feeling better. So I'll leave that as now.
Great clue. That was fantastic. All right, Palette, you're next.
Okay, so the profession I'm part of is slightly more specific as for like where in the body, what we treat in the body. You can find us in the hospital or in private practice. Depending on the day, I guess I can do surgery, but if I don't want to, I don't have to do surgery. I guess it's kind of up to me. I usually see all years, but specifically, we kind of gear more towards diabetics, athletes, all the weekend warriors out there. I would say there's an artistic side to the profession, and everyone may not have seen one yet, but I can almost guarantee at some point in your life, you will have to.
Okay, that was a great clue. Okay, Allison, you're up next. Do you have any hints for us?
Hey everyone. So I basically have an 8 to 5 job. Unfortunately, right now as a student, it's unpaid, but eventually it will be paid. I could work 3 to 5 days a week, depending on where I choose to work. I could work with multiple people or by myself, again, depending on what I choose after school. I critically think about patients' problems and provide solutions to resolve or manage those problems. I care about people's appearances and their health. And depending on the day, it could be a little bloody or it could be completely clean. And if I'm feeling nice and do my job right, then you shouldn't feel a thing.
That was a really good clue too. Excellent. All right, Talia, I'm going to have you go next.
All right. I am a jack of all trades. Whatever it is, it's usually my job to do it or find someone to help me do it or find someone else who's qualified to do it. I work on an interprofessional team to just make sure things get done. I have a broad range of knowledge, so people often expect me to know everything, but I feel okay admitting that I don't and love that there's always something new to learn in my career. Because of my career, I can get very distracted by arm veins when I'm at the gym. In my lifetime, I have stabbed more than 5,000 people. I get paid for this. Many people thank me later. Sometimes I watch you sleep. I might watch you die. I might even help. But mostly, I am doing everything imaginable to help keep you alive, healthy, physically and emotionally, and I'm your biggest advocate. I am a legally certified drug dealer, and I essentially get to wear pajamas to work.
All right, Talia, you right now you are leading the pack with the best for like the Halloween version of your job. I love it. That's fantastic. And then last but not least, Farron, welcome. Please tell us in 1 minute who you are. Oh, let's see. No, we can't hear you. Let me see if I can. Hang on just a second. It says you're muted by me, and that is not the truth. Oh no, Farron, how come I can't get you unmuted? Are you able to unmute from your side? Do you know if your mic is attached? Oh no, Farron, we can't get you unmuted. Oh, there we got you.
Oh,
All
okay.
right, you've got
Okay,
1
perfect.
minute to give us your clue.
Okay, thank you, and thank you for having me here. So I see patients autonomously. I can also evaluate patients' vision issues. I have to have a master's or a PhD. I can work with patients in a wide variety of medical settings, ranging from like a clinical office to a room to the operating room to even nursing homes. I can practice telemedicine and assist patients with relevant advice remotely. My work schedule can be very flexible, and I can freely move around in different specialties with on-the-job training. And I can also work in education with teaching in the scope of my profession, as well as the specific specialties that I feel most comfortable in. And I also work in a very interprofessional, I also have a very interprofessional team dynamic.
Excellent clue. Okay, for my audience, I'm going to go back to my screen share. All right, for my audience, do you all think you know? Are you ready to see? Can you tell me who is the physical therapy student? See what people's guesses are. You guys ready to jump in? So Tatiana, right out of the gates. Okay. All right, let's see how this this works out. So Tatiana, they think you're the physical therapy student, but Palak is kind of a strong number 2, a weak number 2. Okay. We ready to move on? Who do you think is the podiatric medical student? Palak is a strong start with Bren. Okay, very good. You got to be strong in your convictions that you know who is who here. Okay, I think everybody's done. Are we done voting? Almost done? Okay, let's move on. Who is our optometry student? Aaron, all right. Do we have a second guess for this one? Oh, you guys are convinced. Oh, no, Bryn, you are very busy. You have a lot of different careers that you are pursuing, aren't you? Okay. Who is our nursing student? Talia or Bren? Have a couple of people still voting. Dial it in. Yeah, I was gonna say, you guys are leaving Stephen and Sam in the dust. I was gonna say, what do you think they do? There we go. All right, couple more people voting. And this poll is closing. All right, who is our dentistry student? Allison is a strong contender. Tatiana is also a strong contender here. Get a couple more of you to vote. Oh, this one has kind of stumped a few of you. But Allison remains our clear winner on this particular poll. Okay, let's go. Who is our physician assistant student? Bryn jumps out. Again, Bryn, you have been very busy today. I've got a couple more people voting. Okay, it looks like that one's closed now. Oh, a little bit of, are we changing our minds? Okay. And then who is our pharmacy student? Samuel is the clear, oh, followed by Stephen. Okay, so now, oh, Talia jumps up here. Talia, you are very busy today as well. All right, it looks like all of you have voted. All right, here we go. Who is the anesthesiology assistant student? That should have been all of them. Am I correct in my quick head count that we've gone through all? I haven't missed one, right? I've gotten all of you. I just don't want to reveal the next slide if we haven't done all of them. We're good? Okay. All right, couple more votes. Talia gets the leading score but Stephen, you also have been very busy today. All right, are we ready to reveal who is on our panel? All right, let's meet our panel one more time. You guys, a round of applause. You guys did a fantastic job of matching our panelists to their professions. Good job. I'm really proud of all of you. Tatiana, so what we're going to do next is I'm going to have you guys reintroduce yourselves. Take a couple of minutes, tell us who you are, where you're coming from, and tell us a little bit about your profession now that we know who is on our panel.
Sure thing. So my name is Tatiana. I am a current physical therapy student. I go to Texas Women's University in Houston, Texas. And I am a third year, so I am about to graduate very soon. Physical therapy is very broad. We can treat patients in all types of settings, as mentioned before. We can be in the hospital, we can be in schools, we can be in outpatient clinics, anywhere, all over, and we treat all ages. There's lots of different specialties, including geriatrics, neurology, sports medicine, which a lot of people are usually more familiar with physical therapy, but we also treat orthopedic injuries, pelvic health, wound care is also one of our bigger specialties in physical therapy. Most people know us for sports medicine. Some people do work with sports teams. A lot of times people will have surgeries like hip replacements, knee replacements, back issues, and we also help patients with that. We also treat patients who have stroke, brain injury, spinal cord injury, things of that nature. And we are part of the interdisciplinary team working with a lot of other professions like we have here. We work very closely with doctors, surgeons, other therapeutic specialties like occupational therapy, speech therapy. We work closely with nursing in certain settings, and it all just depends on what the patient has going on and what location we're at. You do have to have a bachelor's degree to enter a physical therapy school, and physical therapy school is a doctoral program. As I mentioned before, we are doctors of physical therapy, but not the same as your medical physician. We're a different type of doctor. And then the program is 3 years. You have the option to have residency specialization programs, and there are also fellowship programs as well. There's also physical therapy assistance, which requires a 2-year associate's degree, usually an undergraduate degree, to be able to participate as an assistant. That's all I got.
Wonderful. Bryn, I was going to say, can you please reintroduce yourself?
Yes, hello. So my name is Bryn and I am a Doctor of Optometry student. I think my little spiel there stumped some people. I go to the Southern California College of Optometry. We're in Orange County here. Optometry is much more medical, I think, than most people assume. So we are able to give people prescriptions for glasses and contacts, but that is about 5 minutes of things we can do for hours and hours. So majority of what I learn in school right now has to do with the health of the eye, which is therefore affected by the health of the whole body. So we screen for conditions such as diabetes, hypertension, because often we can get a look at people's blood vessels through their pupil, and we're able to see directly how healthy the vasculature of someone's body is through their eye. So we are a good screening tool for all types of medical conditions, for which we'll refer to one of these lovely people. We also can see conditions such as myasthenia gravis. We can see different neurological conditions, a whole bunch of stuff to do with the health of the entire body. So we are a 4-year doctorate program after you have an undergraduate degree. There is an option for some schools to do 3 years of undergraduate and then come, but usually people do a 4-year degree and then start optometry school. Within our field, there are a major amount of subspecialties. So you can do things such as pediatrics and vision therapy, maybe to do with children with learning disabilities or traumatic brain injury patients. You can also focus on ocular disease, which is then more of the medical side. You can become a specialty contact lens specialist for people who can't even see through glasses and they need these crazy contacts. So a whole wide variety of options within the career. So it's super rewarding and it's kind of choose your own adventure once you're in school.
Excellent. Thank you. Welcome to our panel. Stephen, welcome. Tell us a little bit about your chosen career.
Hi everyone. Um, Again, I'm an anesthesiology assistant student currently. I'm calling in from Case Western Reserve University's Masters of Science in Anesthesia program. Currently, they have 4 campuses, and so I'm specifically calling in from the DC campus. Um, and so basically what an AA does is uh, pretty much everything that an anesthesiologist does. And so that includes everything throughout the entire perioperative period. And so that's from, about when the patient walks into the hospital for, an elective or could be a trauma or urgent procedure or surgery, all the way through putting them to sleep, um, keeping them relatively stable during the procedure while they may be asleep, and then waking them up and ensuring that they are safe and sound in the post-operative period as well. Um, a lot of times, there's a joke about anesthesiologists or AAs in that we are certified kind of professional people that poison you intentionally, but just at that border, that fine line between a toxic dose versus a therapeutic and kind of unconscious or sedated level. We perform in the ACT or ACT team model, and what this entails is it stands for anesthesia care team, and so a lot of times in a large hospital, there'll be an MD, anesthesiologist that will be supervising multiple rooms of anesthesiologist assistants or CRNAs or PAs or things like that. And so I kind of think of what I do or will be doing as uh, almost like a mini or baby anesthesiologist. And so I think it kind of offers the balance between, autonomy and that you're caring for a patient directly in your own operating room, but if you do need additional help or guidance, there is that supervising anesthesiologist there for you as well. A lot of times in the operating room, we will be located at the head of the patient, and so with that comes a lot of responsibility in terms of essentially acting as their guardian angel. And so pretty much we're advocating for everything that the patient might need, because if they are unconscious, they can't really advocate for themselves. And so a lot of times that entails being a professional declutterer, straightening out wires, making sure that they're padded on their body, on the operating table, stuff like that, so that there's no pressure points or anything like that. A lot of small details that go into making sure that the patient stays safe during this surgical time period.
Wonderful. Thank you for that description. That's perfect. Samuel, you want to tell us a little bit about your chosen profession?
Yeah, absolutely. Hi, everyone again. My name is Samuel. So I'm a pharmacy student. I'm currently a P4 student. So I have 3 more months to be done with school. So in the profession of pharmacy, like I said earlier, it's one of the most accessible and easiest healthcare professions that you can find in the community. I'm sure each one of you have either CVS or Walmart or Walgreens or Costco, whichever one available to you. You don't necessarily have to buy every single, you don't necessarily have to let your doctor prescribe every single medication for you. I always have this joke that everybody is a pharmacist in their own way, because some way, somehow, you know that when you have a headache, ibuprofen won't help you, but Tylenol will. You figured out yourself. So in that way, you're a pharmacist. The only difference between you and me, or probably anybody in my field, is I'll borrow Tyler's words. I'm a legal drug lord, and you're probably not legalized yet. Currently, I am in UIC, that's University of Illinois College of Pharmacy. We have two campuses. Sorry. We have two campuses. There's one in Chicago and there's one in Rockford. I'm currently at the Rockford campus. So in the field of pharmacy, there are a lot of places that you can work at. You can work at the community, which is probably the most common one. You can also work at the hospital, and even at the hospital, you can work at different floors. So it's cardiology, if it's infectious disease, if it's surgery, if it's transplant, whichever specialty that you're interested in. Um, you don't have to get a degree before you can come to pharmacy school. You can use 2 years or whichever years that you want to do your prerequisites, and then you can just start pharmacy school. There are also some schools out there that will save you all these prerequisite stress and have the entire prerequisite and pharmacy school in a 6 years combined training. So after 6 years, you'll be done with your pharmacy school, which you have both your prerequisite and your pharmacy as well. In terms of fun fact, probably why I went to UIC, it's because UIC is a top 10 pharmacy school in the United States. It also has a bad research background. It has a big academic institution. So these are all stuff that I chose UIC. There are also a couple of schools out there. If you're interested in knowing which schools are the top, doing what in research and stuff, just type, US. I normally use US News, top 10 pharmacy schools in the United States or something, and then it should pop up. So thank you.
That is a great piece of advice. Excellent. Thank you, Samuel. It's nice to have you here. Pollock, welcome to our panel. Take a minute to introduce yourself.
All right. Hi, guys. My name is Pollock. I am a third-year podiatry student. So I'm coming to you guys from Philadelphia, Pennsylvania, and I go to Temple School of Podiatric Medicine. There are a total of 9, I think in the next year, possibly 10 podiatry schools in the United States. One of them being in Philadelphia. I believe the new one is in Texas. There is one in Florida, a couple in California, Arizona, Chicago area, and New York, if I've hit all of them. But so I will graduate with a doctor in podiatric medicine, so it'll be a DPM, will be at the end of my name. My profession so we focus on the lower extremity. We learn everything from the hip downwards. Well, we learn the entire body, but we focus on everything from the hip downwards. But as for working with, we specifically work with the foot and ankle, which you may think is such a small part of the body, but you walk on your feet every single day. So I think you will get to realize how much of a toll that actually takes on your feet. So some of the things that we can do, if you find us in the hospital, we're most likely doing surgery. So we do get trained to become surgeons by the time we graduate. The program is 4 years, and the residency is a surgical residency. So all 3 years you will be learning the ins and outs of surgery. And I don't know if I mentioned the residency is 3 years. So if you find us in the hospital, we're most likely working on trauma cases. So an Achilles rupture for runners or athletes, as well as like those pesky hammer toes and bunions, which everybody somehow ends up getting. Working on those. If we're not in the hospital, you'll find us in private practice or maybe in like a group practice. A lot of what we see there is that plantar fasciitis. I have pain here and I have no idea why. Meanwhile, they just finished running a marathon. Corns, calluses, warts, honestly, anything that has to do with the lower extremity. So because of that, we kind of become really proficient in like derm. We're really good with derm. Work very closely with vascular, anesthesia, infectious disease, all those specialties. And we can prescribe medicine, so we are allowed to do that. And I think that's mostly it. Oh, I would say another part of podiatry that's kind of not as common, but orthotics are mostly prescribed by podiatrists. So if any of you guys have custom orthotics or have ever gotten casted, biomechanics is a huge part of podiatric medicine. So like how your hip affects your knee and your knee affects your foot. So there might not be anything wrong with your foot, but if there's something wrong with your knee, you'll most likely feel it in your foot. So we work a lot with physical therapy, internal medicine, honestly, all the other physicians, doctors in the healthcare field that you're seeing. We usually work closely to figure out, is it the knee that needs to be targeted? Is it the foot that's affecting the knee? So it's a lot of putting the puzzle pieces together. And I would say lastly, a lot of the population we see aside from athletes are diabetics. Those with diabetes, usually at some point you lose sensation in your feet. So we have a lot of people who come in who may not be able to clip their own toenails. They may not have good pulses in their feet. They may have stepped on something and not known it for almost like a couple weeks to months. Like, believe me, I've seen some crazy things of people not knowing. So I would say a lot of people say that podiatry is kind of like the internal medicine, the family medicine of your lower extremity. That might have been too long, but there we go.
I love it. That's a great way to look at podiatric medicine. So, Allison, tell us a little bit about your chosen profession.
Yeah, hey everyone, my name is Allison Temple. I'm a current third-year dental student at East Carolina University School of Dental Medicine in North Carolina. It's a 4-year program that you do after your undergraduate degree to get your Doctor of Dental Medicine. Real quick, I wanted to tell y'all a little bit about why I chose to go into dentistry. I feel like a lot of people have different reasons. Sometimes it's because you had a bad experience with braces or things like that. Mine was a little bit different. When I was in high school, I went on a mission trip to Guatemala, and when we were there, I spoke a little bit of Spanish back then. I don't speak that much anymore. I'm relearning, but I spoke a little bit of Spanish, and the little children talked to us a bunch, but a lot of the adults didn't. And so I eventually, before we left, asked some of the kids, did we do something? Is there a reason why they didn't speak to us? And they were like, they don't have any teeth. And I just kept thinking to myself, that's something tangible that I could help them with in the future, whether that's with dentures, different things like that. And so pretty much since then, I've been hooked, started shadowing, fell in love with the profession. And I really love dentistry because it's a profession that combines people's artistic side with their surgical side. And it really makes you think about the whole body. We, to be honest with you all, do probably 2 years of medical school on top of dental school, and it's all clumped into our curriculum. And so you really do spend a lot of time learning about the whole body, different pharmacology and drugs that people take for different reasons and how they can affect your oral hygiene, things like that. It's a career that you're really always learning, just like everyone else here. There's always new technology coming out. There's new continuing educations, things like that. We have 12 different dental specialties right now. I won't bore you all with all of them, but essentially, if you want to be more administrative, you can. If you want to do more with public health and serving your community, there's a profession for that. If you want to do more surgical things, you could be an oral surgeon where you do like facial reconstruction, pull teeth, things like that. A periodontist deals more with your gums, and so they would do gum grafts, place implants, things like that. We also have oral medicine, and so if you are interested in kind of how everything comes together and relates or affects your oral cavity, oral medicine would be the profession for that. We also have general dentists, which is personally what I want to do. And so they do a little bit of everything. And so you could pull teeth, you could do some of the root canals, place implants, things like that, Invisalign, braces. If you're comfortable with it and you have the proper training to do it, you can do it. And so that's something that really interests me, is just being able to do a little bit of everything. aside from being a dentist in the dental profession, you also have dental hygienists. And so dental hygienists are probably who we as the general public see more often. So whenever you get your teeth cleaned, you're seeing a dental hygienist. And they really, I mean, they keep the practice running at the end of the day. And so they're the first ones who kind of see you, can get an idea of, hey, I think this person has a couple cavities, and they'll be able to let the dentist know. The dentist does an exam. Yep, you're right. We do the fillings, things like that. And so the hygienist really is who most people see typically. We also have dental assisting. And so I was a dental assistant before dental school. And dental assisting is a really great way to get your hands dirty and involved with a little bit of everything in the practice. And to be honest, they keep the practice running. And so without a dental assistant, I feel like a lot of dentists would go crazy. And you learn that, or as someone who was a dental assistant now in dental school, not having a dental assistant, I just can't wait until I get on the other side and have my own assistant, because it really is kind of a four-handed job. It's really hard to do dentistry with just two hands. But yeah, that's probably too much information, but I'm very passionate about this profession, clearly.
Wonderful, Allison. Thank you so much for sharing all of that. Talia, tell us a little bit about your profession.
Sure. Thank you, Allison. I have to start off by saying I'm a little concerned that someone guessed that I was the dentistry student, since I said one of my things was that I sometimes help people die. I was referring to being a hospice nurse. Dentist, not so much, I hope. So there are many different paths and avenues that you can take to get into nursing, and then once you're in it, different directions that you can take. So I'll just share a little bit about what my journey has looked like. My background was in mental health with a strong interest in global health. I did an undergraduate degree in psychology first, and then lived abroad for a while. And when I was there, realized that my idea of healthcare was much more of a holistic approach, and nursing fit really well with that. So I came back to the States and did what's called an accelerated bachelor's of nursing. So I was able to get a bachelor's degree of nursing within 12 months at the University of Miami. And I've been working at the bedside for the past 10 years, predominantly as a cardiovascular surgical step-down nurse, and spent a few years as a travel nurse bouncing around the country and kind of experiencing all of the different elements of nursing, because when you're a travel nurse, you float to all of the floors. So got a little taste of everything. I am currently in a doctors of nursing practice program at Rush University in Chicago. And I chose to do the family nurse practitioner track in their DNP program. Just so people are clear about the doctorate programs in nursing, you can take two different tracks. You can do a PhD in nursing or the doctors in nursing practice, the DNP program. PhD is more research focused and DNP is more clinical and helping to try to translate some of that research, like incredible research that people are doing, into practice. I chose the FNP program because, as I mentioned before, I'm really interested in this idea of holistic medicine, treating the whole person, whether that be any of their physical things going on and their social concerns, their emotional concerns. Like, let's figure out how to keep people healthy. But like I said, there are many different options for you if you want to get into nursing. You can specialize and do something like pediatrics or be a nurse anesthetist, or you name it, there's probably a role for you in nursing.
I love it. That's a great message. Thank you so much. All right, Farron, tell us a little bit about your profession. Are you unmuted? Do I need to help you get off of mute?
I think I got it. Thank you. I appreciate it. This was my first time using Go to webinar, so I'm just a little unfamiliar. So thanks for your patience with me. So currently I'm a second year PA student at Marshall B. Ketchum University in Southern California. Essentially, a lot of PA programs are about 2 years to 3 years long. My program specifically is 27 months. And the nature of how PA school is, well, first off, it's very fast paced, because the first year it's a didactic phase where you're in the classroom every single day and you're learning all this different clinical medicine information. And then once you finish that first year, then then you transition into the clinical phase. So that's where I'm currently at, and I'm about to start my first rotation in pediatrics. And essentially how the rotations work during the second year is that every 5 weeks you get to move around to a different specialty. So I'm starting in pediatrics for the first 5 weeks, and then I'm going to probably move around, like, and the different specialties would include like family medicine, ER, an elective of my choice, OBGYN. So it's just you get a little taste of everything, and it's really helpful to figure out, like, okay, where do I feel like I want to be specialized once I graduate PA school. And essentially my role as a PA, I can see patients on my own, I diagnose, I treat, and I can prescribe medication. I do work closely with a supervising physician. And then, oh, just another background about like the track to PA school, which I forgot to mention. You do have to have a bachelor's degree and meet the prerequisites to apply to PA school. And then once I finish PA school, I will receive a master's degree. And yeah, so just wanted to make sure I clarify that. And essentially, like, I think the great thing about being a PA is I can help, I'm going to be helping a lot of different people, and I can move around in different specialties, like, say, yeah, so I'm really excited about that. And then also after PA school, I do have the choice of completing a fellowship if I want to become even more specialized and um, yeah, be able to be more like confident in my skills, because once you finish PA school, you get hired in a specialty. Like, say for example, if I want to go into like orthopedics, then I get on the job training for about a few months, and like and then I start seeing patients on my own and doing everything on my own. But a lot of people like to do, like, for example, if they want to go into OBGYN or ER, where those are can be like really, really challenging specialties, then you can do a fellowship. So you have that option as well.
Excellent, thank you. My goodness, our hour is almost up. So I've been answering questions in the chat while you guys are talking. So I think I feel like our chat questions are in the clear. So I have one question. I would like each of you to answer it for me. And this can be either your personal advice or just a great recommendation. If you were talking to somebody and they said, what is the one way that I could learn more about what you do? What would you tell me to do? And because my Brady Bunch has changed, Bryn, you're going to get to go first with your one piece of advice or recommendation. Yeah.
I would suggest talking to someone in the field or someone who is currently in school. So I know for us at Southern California College of Optometry, there are a bunch of current students' emails on our website that you can reach out to with questions. If you would rather talk to someone in person, I would recommend going to an optometrist in your area and just asking them more questions and maybe shadowing them. Because the internet has a lot of info, not all of it's true. Some of it may be. I just think talking to someone who has gone through it and is currently in it is the best way.
Wonderful, thank you. Stephen, if I asked you what's the best way to learn more, what would you say?
I think one thing that's important to know for certified anesthesiologist assistants, CAAs, is that they can currently they are restricted to licensed practice within a select few states, and so and possibly like delegatory authority, special exceptions in other states. I do know that it's growing, and there's a lot of current legislature that's being passed in terms of allowing AAs to practice across the country. So of course, if you are in a state where CAAs do practice, I would just reach out to one of those practicing professionals. There are several schools across the country as well that you could reach out to. I know CASE, specifically us here, if you just email the administrative office, we occasionally do have people, students that are interested, come and shadow, as well as learn more about the program. You can look online as well. I am personally from New York, and so New York, you currently cannot practice as a CAA. And so the way that I found it was also looking online and reaching out to various schools and things like that. And so, if you are not in a practicing state, you could certainly shadow an anesthesiologist, things like that. Just get in the operating room and see how the profession is, stuff like that, and just try to like learn more about that in general.
Excellent, thank you. And Samuel, how about for you?
Yeah, I would say basically what Stephen and Brian said earlier. It alludes for everyone as well. If you are in doubt, you can also read about it before you approach whoever that you're interested in at. Um, I don't recommend really typing what does a pharmacist or a doctor or a nurse do, because like Google will give you answers that you have no idea about. Just actually going on the site itself. So if it's pharmacy, even if you type pharmacy.com, I'm sure it should direct you to factual places where you can get really recommended articles and stuff to read at. But also like within the different fields, whichever one that has started to gain your interest. So if it's pharmacy, you can just walk into your retail pharmacist. I know people might think it's hard, but every institution has this social requirement for giving back to the society. And one of them is to help students who are interested in learning about that profession. So even if you go to them and tell them about your interest, they can arrange for you a day or an amount of time for which they are not that busy for you to shadow them and learn from them what they do for the day. You can do the same for hospitals. If it's a private pharmacy, you can do the same wherever that you are. I think that's probably the ways to start from.
Excellent, I love it. Palak, what about podiatric medicine? Oh,
There we go. I didn't know where the unmute button was. I would say reach out to a student as well as a podiatrist. I would say do both because obviously being a podiatrist day to day is much different than the process of getting the degree. So just to be like realistic with yourself about what you need to do to, be in this profession, I would say talk to a student, see what that whole experience is like, talk to a podiatrist, and like kind of like what I said earlier, a lot of podiatrists do different things. So you might find one that everyone gets trained for surgery, but that by no means that you have to do surgery once you graduate. So you could shadow a podiatrist that is like heavily doing surgery, or you could shadow one that like basically only makes orthotics, and that's most. So I would say like talk to a couple podiatrists, but then add a student in the mix just so you get the entire story.
yay, that's a great piece of advice. Allison, what about you and dentistry?
Yeah, so I feel like resources are endless and there's opportunities everywhere. I know depending on where you live, if you're in a more rural state or rural community, it can be hard to find a dentist sometimes. So online resources can be a good option too. Two huge organizations that deal with dental students, pre-dental students are ASDA, the American Student Dental Association, and ADEA, the American Dental Education Association. And those two organizations do a lot for pre-dental students, allow you different opportunities to attend conferences when you're a pre-dental, and then kind of segue you into a dental student and then beyond as a dentist in organized dentistry. So those two organizations, I would say, have an abundance of resources on their websites, Instagram, things like that. But my other biggest piece of advice would be to find a mentor. And so just like everyone else has been saying, whether that is someone who's a current student, an advisor at your college, in high school, or a dentist, hygienist, assistant, whoever in your community, all of those people are going to be able to point you in the right direction of finding different resources, connecting you with the right people, because a lot of all of our professions is networking. and you're always able to meet new people wherever you go. And so don't be afraid to put yourself out there. I know it can be very intimidating, especially when you're in high school or college, but don't be afraid to put yourself out there, because that's how you're going to make those connections, and how connections that are probably going to help you get to where you want to be. So definitely find different mentors and utilize as many resources as you can.
Love it. Excellent to look for the student organizations and the professional organizations. I think that those are key as well. Talia, what about you? How can students learn more? Because there's a lot of options within nursing.
There is. And I mean, I want to echo what everyone else has been saying, that just getting involved, volunteering, finding a mentor is the best first step. But while you're doing it, make sure you keep an open mind, because you might go in thinking that you want one particular part of a healthcare career and then start to be interested in something else and find yourself on a different path. In terms of nursing, in any healthcare profession, you're going to get very friendly with acronyms. So let me throw a couple at you. The ANA, the American Nursing Association, has a ton of great resources on their website about what nursing is and different options for school. And then also the AACN, the American Association of Colleges of Nurses, specifically their GNSA, the Graduate Nursing Student Academy, has a great set of resources for you, webinars, opportunities for mentors. There are all kinds of things on there. So it's out there. You just need to look a little bit, and like Samuel was saying, like filter through and make sure that they're credible sources.
Excellent. Farron, what about you? What advice, or where can students learn more?
I would say like the place, I would say like I would recommend students to work as a scribe, because that way you'll get hands-on experience, like working like every day with a PA or a doctor, and then you'll practice like documentation as well, or working as a volunteer with like having direct patient care experience. I feel like that's really important.
I agree with you as well. Tatiana, bring us home. The last little piece of advice then.
Sure. I definitely want to echo what everyone has been saying. Definitely shadow, observe, volunteer with a physical therapy clinic, whether that be in a hospital or an outpatient clinic, whatever setting you want to be in, whatever specialty, just get that exposure to what the day-to-day job of a physical therapist is. And also our American Physical Therapy Association website has a lot of good resources. That's apta.org, where you can find a lot of different information about the profession, about becoming a physical therapy student, and how to be a physical therapist, research, all good things there.
Excellent. And what I'm going to do is I'm going to give just a shout out to Health Professions Week, because all of these organizations that students here have talked about and listed, minus the student ones. But if you're talking about going to ADIA or going to APTA or to AACPM or the AAAEP site, all of the ASCO sites, all of those are available on our website. And so if we talk about credible, reliable resources online, HPW is an excellent place to start your search. And we have lots of tools and resources. As you can see on the screen, or I hope you can see, we have lots of live events all throughout the year. I want to say a round of applause to you guys. You guys did a fabulous job today. Thank you so much. But this is just one of the type of live event that HPW hosts, our Guess Who panels. We do also profession panels. Our next one is in just a couple of weeks, and so we'll be talking about careers in surgery. When this will be with actual health professions. And so I encourage you to, if you are intrigued or interested in any of the gory details that you heard today, and you think that that might be a direction that you want to go, you're all invited to come. Or if you just want to come and listen and see about this. But HPW has lots of resources, and so you can get that by logging in to the explorehealthcareers.org website and then look for Health Professions Week. So Thank you. You guys, this was like I said, this is the biggest panel we've ever done. You guys did an amazing job. Thank you so much. I hope you had fun. And if anybody has any questions, all you have to do is hit reply to any of the emails that you get from Health Professions Week. And if I can't answer it, I will track down the right people who can answer your questions. So thanks so much, everybody. And I hope to see everybody soon. And I hope to see a lot of you at our next live panel. All right, we'll talk to you guys soon. Bye.